All right, team, we have a patient with 3 symptoms.
Tonsillitis, membranous glomerulonephritis, and gingivitis. What do we think is the diagnosis?
Based on these symptoms, I would say it could be an autoimmune disorder affecting multiple systems.
I'm leaning towards an infectious cause, possibly a bacterial infection affecting various organs.
I think it's more of a systemic inflammatory reaction, maybe due to an underlying chronic condition.
Enough. This is not your average case. The diagnosis is Center of Expertise for Rare Diseases. We must perform a cystectomy immediately.
But Dr. Hawks, a cystectomy is a highly risky procedure. Are you sure it's the right course of action?
I don't give a damn about the risks. This is the only way to save the patient's life. Now scrub in, all of you. We're going in. Tracy, I need your approval to perform a cystectomy on my patient. I strongly believe they have a rare disease that requires the expertise of a specialist.
Hawks, I understand your concern, but we can't jump into such a major surgery without consulting the proper channels. Have you consulted with our specialists?
I have, Tracy. I've spent years studying and practicing medicine. I know when something is beyond the ordinary. Trust me on this.
Hawks, I appreciate your dedication to your patients, but we have protocols in place for a reason. Let's get a second opinion before moving forward with the cystectomy.
I can't believe you're questioning my experience and judgment, Tracy. This patient doesn't have time to wait for bureaucracy. I have to do what's best for them.
Hawks, it's not about questioning you. It's about ensuring we're making the best decision for the patient. Any information we need before proceeding.
How could this happen? The patient is in critical condition. I need to tell Hawks that the cystectomy was not the correct treatment for Center of Expertise for Rare Diseases. This changes everything.
What in the hell were you thinking? You almost killed our patient with your incompetence.
But we follow the standard procedure for cystectomy, Dr. Hawks.
Maybe it was a miscommunication. We verified everything before the surgery.
I still think it was a case of misdiagnosis, not surgical error.
Misdiagnosis. You're all a bunch of clueless fools. Can't even tell a simple cystectomy from a damn hernia repair. Unbelievable! I'm done with this circus! Figure it out yourself! I can't believe we still haven't figured out what's wrong with the patient in room 302.
Come on, Hawks, you're supposed to be the top diagnostician here. Maybe it's a rare tropical disease.
Haha, very funny. Maybe you should stick to nursing instead of trying to diagnose patients.
All right, Dr. Hawks, how about a severe case of food poisoning? Or an allergic reaction?
No, I don't think so. Wait a minute.
I've got it.
What? What have you got?
I know what's wrong with the patient. Sorry, Johnson, I gotta go.
Duty calls?
Hey, wait, what is it? Hawks? Don't leave me hanging like this?
Storm's in.
Hawks, what are you doing? You can't just barge in here without proper gear.
This is an operating room, not a playground, Hawks. You're endangering the patient's life.
Hawks, you need to leave, now.
Ignores their comments. The Center of Expertise for Rare Diseases got it wrong. It's Zollinger-Ellison syndrome. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. But let's not forget the wrong diagnosis almost cost the patient their life.
If you had listened to me from the start, we would have avoided this whole mess.
And if you had trusted my instincts, we wouldn't have wasted precious time.
My instincts were right all along, Tracy. You need to start trusting me more.
Trust goes both ways, Hawks. Maybe next time we can work together instead of against each other.
I'm just glad the patient is alive, despite our differences.
Agreed. We both need to learn from this experience.